In this video, we're going to have a look at some easy exercises to rehabilitate the rotator cuff for somebody who's suffering from rotator cuff tendinopathy, or what's previously been called impingement syndrome. So we can start off by using some isometrics, and in particular, isometric external rotation can be a very simple way of engaging the external rotators and also causing some desensitization of a painful shoulder. So a useful analgesic method. All you need to do is instruct the patient to hold their arm in that position, educate them about external rotation whilst keeping the arm by their side, so not abduction, just basic external rotation. And then from that neutral position, from that 90 degrees to the body, they can just use their opposite arm to provide some resistance and then just externally rotate out into their arm. And this exercise is sometimes being called the Paracetamol Exercise because it's a quick and effective way at reducing shoulder pain. And this sustained effort can be held for a short period of time, so you might advise them to do it for 30 seconds, for example. We can also do this same technique against the wall, which is exactly the same except you're using the wall rather than the opposite hand for resistance. So the patient's just pushing into the wall there. There is sometimes a danger when they're doing this that they'll try and do a general abduction. So make sure the elbow is away from the wall and it's just the back of their hand that they're pushing into the wall, so they've got a pure external rotation position. It's not wrong to do an abduction, and they could try and do an abduction. It's just effectively a different movement, but if it's effective again at reducing pain, then basic abduction against the wall is something that they could also do. Now if I can ask you to turn back this way, and then we're going to add in a little bit of resistance to make things a bit more dynamic. So using an elastic resistance band or a cable machine, for example, we can then start to teach the patient an external rotation. Now it's a good idea to make sure they start with their arm across their abdomen and that the resistance is initiated from that position out into external rotation. If they're struggling with this and they're making the mistake of abducting, then if you just tuck something underneath their arm, a small rolled up towel for example, this means they have to hold that in place and it prevents them habitually abducting their arm, and it keeps it more as a pure external rotation. Another thing to think about, just a quick tip if you're teaching this exercise, is that people often will externally rotate right out towards the end of range. Now that's okay for most people, but also for some patients they will report that they feel pain as they move out into end range external rotation. Now to get the benefits of this exercise, they don't need to rotate all the way out here, and in fact if they've got a long head of bicep pathology, this can be particularly irritating as well. So start across the torso, bring it out to 90 degrees to the body so the forearm is facing forwards, and that's far enough to go a little further if they want to. But if they're experiencing pain and discomfort, it's probably because they're using too much external rotation range. So keep the range a bit shorter to increase comfort, and then we can look at increasing the range if necessary. So towel under the arm and making sure they don't externally rotate too far if that's causing them discomfort are two tips you can use to teach them this exercise. Okay, so that's our video on easy rotator cuff exercises. If you have a look on the screen here, you can see our other video on slightly more difficult or moderate difficulty exercises for rotator cuff, which effectively will be progressions from these. So once you've got your patients used to these exercises, have a look at the next video, which is a natural progression of these exercises. Okay, thanks for watching. Please like, subscribe, and we'll see you in the next video.